Sex, intimacy, and cancer. So those three words pretty much sum up the conversation we're about to have here live tonight in the Windsor Regional Hospital Cancer Center. It's a conversation that I'm told doesn't happen as often as maybe it should. So we're going to rip the bandage off of that conversation tonight. You guys ready?
Absolutely.
We're ready. All right. Well, welcome everyone to Cancer Center Live. I'm Allison Johnson, Manager of Communications here at Windsor Regional Hospital, and really excited to have our guests here tonight. I want to introduce you to John and Sue, our friends. Both of them have had their own journeys through cancer and have agreed to share them with us tonight. Welcome.
Thank you.
Thank you. You want to tell us a bit about your journey?
Yes, I'm a cancer survivor. This is my fourth summer cancer-free. I was diagnosed with colon cancer, and it moved to my liver. It was stage 4. And I'm here to talk about it, so I'm thoroughly blessed.
And we're happy to have you. Thank you.
Thank you.
And Sue?
And I had breast cancer last year and had a mastectomy. And as of this past January, I'm clear, and I'm happy to be here as well.
And for those of you who haven't tuned in before, this is Cancer Center Live, and the way that it works is each month we provide a different topic and different guests. We also have another guest with us tonight, but as you can see, because of the size of our studio here, we can't all fit on at once, but we're very fortunate to have Dr. Ann Katz joining us tonight as well. Ann is a sexual and intimacy counselor for healthcare staff and patients with cancer. She's also the author of several books. And tonight we have a giveaway. Everybody who participates in our discussion tonight will be entered into a draw for the possibility to win one of her books. She's the author of Sex When You're Sick, I'm Not That Person Anymore, A Nurse's Journey Living with Breast Cancer. After You Ring the Bell, 10 Challenges for the Cancer Survivor, and we talked about this one a couple months ago, and that had a lot of discussion. And also Women Cancer Sex and Men Cancer Sex. She's a great, great resource, lots of information. So post your questions now. And of course, the way that Cancer Center Live works is we're here to talk about this, to answer any questions you have, but really we want you to drive the discussion. So throughout tonight's discussion, please post your questions for us, and whether they're for John and Sue or for Ann later, we'll do our best to get you answers. So, I have to say, the one thing that surprises me about Cancer Center Live right from the beginning was we had this idea and we thought, this is a great idea, a great way to connect with people through social media. It's going to be really hard to get people to share their stories with us. And then when this topic came up, we knew that Ann Katz was coming to town and we wanted to discuss it. I thought, I am never going to find someone to talk to me about this topic and be so open and share. And a friend of mine who works here said, you know what, I know this couple. They're going to be really great. Why don't you give them a call? So I call Sue. I think you might have had a little bit of warning that I was going to call. But I call Sue, and I want to invite her to come and talk very openly about her life with her husband. And I said, okay, Sue, it's Allison, and we have this conversation, and I don't use the word sex. I'm saying, we're going to talk about relationships, and we're going to talk about how hard cancer is on relationships. I think you use the word relationships many times. And then Sue says, yeah, it's got to be really hard to for some people to talk about sex so publicly, but I think it's an important conversation to have, and we're in. So thank you for opening that door, making me more comfortable. I think I was sweating like my grade 7 teacher when he started to have that conversation with us all, but an important conversation. So let's start off with you, John. Maybe talk a bit about, because you were the first to go through this. What impact did it have on your relationship and the intimacy?
It was a little bit about an adjustment, of course. You know, going through cancer, going through chemotherapy, it's an emotional stress on you as well, and on a relationship. But Sue and I tried to be compassionate with each other. We tried to be
as normal as
possible. Try to live as normal as possible. A lot of talking, a lot of hugging, a lot of discussion, just really bouncing off your partner a lot to get the feel of what you have to go through. Mm-hmm. And you need your partner to get through it. You really do. And you have to communicate with your partner. And that got me through it.
Right.
Yeah.
because, from what I'm learning through the discussions that we have on this webcast, that, so cancer changes everything, right? And so when does the topic come up about how it changes things in the bedroom?
Well, that's kind of a good question, because I wanted to stay intimate or sexual with my wife, and I wanted to make sure that basically it still worked. So
Use it or lose it was the phrase that you used the first time we talked.
So what I did is I went to the drugstore, because for the first 48 hours after chemotherapy, I'm poisonous to my wife. Any bodily fluids, I'm poisonous to her. So I don't know if I'm using the right word, but I think everybody understands. So I go to the drugstore, and I felt like I was 20 years old again, buying condoms. So I goes up to the counter, and I puts the condoms on the counter, and the girl kind of looked at me. She said, "Really, what's this guy doing buying condoms?" But that...
From everybody who else I've talked to about going through chemotherapy, they're still sleeping after 48 hours, but you're at the drugstore buying them.
Well, I did nap from time to time, but I made my way to the drugstore. So, yeah.
And why was that important?
It was important for me, and I think it was important to Sue as well, to keep the intimacy, to keep the sexuality alive through cancer, which helped us stay connected.
But like you said, you wanted to make sure that the chemo that was being given to you wasn't going to affect everything.
Affect everything.
So just be as normal as possible.
Yeah.
Did you go to the drugstore too?
Yes, we did.
Yes.
Yes, I did. I was standing to the side though.
Yes. She didn't want to hang
Just
around
like
with me.
teenagers.
I was buying condoms.
Yeah.
What about, so you, Sue, did you worry that, you were going to hurt him, that something...
Oh, no, I didn't. No, I wasn't worried.
Anything different?
No, not at all. It just,
I was tired.
but it didn't stop you,
No.
No.
us.
So it's a new normal, like you said.
It's an adjustment. Mm-hmm. Absolutely. But making the effort is everything. You have to make the effort.
How tough was that to make the effort?
Sometimes I didn't want to, but I did, because I knew that's what he needed, and that's what you do for each other. Sometimes you just have to suck it up, and
Why didn't you want to?
I might have been tired or
Oh.
just.
How do you find, how do you find that spark, and how do you push through when you are tired, or when you are not feeling well? Or are there times when you just have to say, I don't want you to be touched right now?
Sometimes we do. Sometimes I do. I'll say, we're very open that way. We're able to talk to each other and tell each other how we feel, and we respect each other.
Communication and honesty will get you through anything as a couple.
We had a question. Somebody sent through email. This is for John and Sue, and it says, sometimes you get caught up in making sure things feel normal for your partner, and you forget about yourself, and this removes you from the sensation. Is that something that you experienced?
Not particularly. No, I didn't experience it. I don't know if Sue did.
No, I didn't.
But we just try to be as normal as possible. And it's difficult when you're going through any type of therapy or cancer itself, but you make the effort to try and be as normal, because it helps you get through it.
And even with me having the mastectomy, that's even worse, because I only have one breast now.
Right.
But he made me feel comfortable. I still felt like a woman.
Well, let's talk a little bit more about your experience. Can you start from the beginning there?
Well, I had the mastectomy, and even from the beginning, from the hospital to home, he was just always there, and I just didn't feel different. He didn't treat me different. Everything was still the same. I just had one less breast, that's it.
So that had a lot to do with his approach.
Yes.
What did you like about his approach?
Everything stayed the same. He still complimented me like he always did. Everything was still the same. Nothing changed. You have to just be normal, and
Normality will get you through it. It really will. And I didn't treat her like she only had one breast. I just treated her like I always do.
What about how you felt about yourself? Did that change? Because that's equally as important as how...
no, it didn't. I never felt sick. I never even No, like even him shaving my head. That's part of it too.
Yeah, we had a little thing going on, and she said, I didn't really want to wake up one morning and have a clump of hair in my hand. So she says, well, why don't we take some pictures? So I cut her hair was past her shoulder, so I cut a little bit, we took a picture. I cut a little bit more, we took a picture. We kind of made it, and then we...
Fun.
Yeah, then we cut it down, and then we took a picture.
And I think that what you're saying is important because at the beginning we introduced this show as cancer, intimacy, and sexuality. And it's not just about the sex. That is an important part, that sharing in the journey of...
Everything.
And so what was that like for you?
It was fine. I had fun. It was harder on him than it was for me.
And just watching
I really
her go
had
through
no
it was a
problem
little
with.
bit difficult for me, but...
Yeah.
And you've gone through the experience yourself. And then so which one was easier?
It was easier for me to go through it than watching her go through it. A lot easier. Because it's okay for yourself. You accept it, you deal with it, you battle through it. But to see a loved one go through it, it's emotional. It rips your heart out.
I had no problem with any of it.
She was too positive. She's a very positive lady.
We talk about that all the time, and we've seen that with other couples, that it's often having that strength and support next to you that goes a long way.
It gets you through it. It really does.
Mm.
And what did he do to make you still feel like a woman? What was it?
Just the compliments, just being normal like we always are. Like
Flowers.
nothing changed.
Flowers.
Yeah,
I
but you
always send
always
her
send
flowers.
me flowers. But even without flowers,
Normality.
just
Being normal, that was important.
Yeah.
that's just us as a couple.
Yeah. Yeah, it's be normal, absolutely.
What advice do you have for others who might be in this situation right now?
Honesty,
Communication,
Honesty about what?
about everything you're going through.
how you feel.
How you feel about your partner, how you feel about what you're going through. Share. If you share with your partner, they understand what you're going through, so you can understand what they're going through.
And what about you? Anything different?
No, pretty much the same. Just the respect and it's just so important to be, like I keep reiterating, but it's respect, the communication, just talking
And
a lot.
And a lot of support from people in the background, like family and friends, and yeah, a lot of support.
One thing that I remember from a conversation that we had previously was that the treatment also had an impact on your emotional or behavior, that you weren't quite yourself.
I was easily agitated, and I think it was because of chemotherapy. It went to my head, and it made me the person that I'm not usually. And I wasn't mean or anything. I was just easily to anger and easily agitated.
So not yourself.
Not myself. No.
So is it different when you're, trying to nurture a romantic relationship with somebody who's not really the person that you're used to?
Well, those chemo weeks were difficult, and you have to have a lot of patience. I tried to make him laugh. I would hug him more, so he needed that reassurance. I think that's what a person needs to, is reassurance, to know that you still love them, you still care about them, they're still number one. It's just a lot of hugs.
And clearly you guys did something right, and you came through these two journeys, maybe even stronger. But was there ever a moment when you questioned?
No. Not for me.
Well, no, I was just worried about Sue. I wasn't too worried about myself. I was positive, but I was scared.
Right.
I was very scared. And but I got over it. There was a lot of positivity between us. So, you move forward. You take it in and you move forward.
But sometimes, okay, so when you're about anything in life, you're scared, you're stressed out, maybe sex isn't top of mind. Or it's something that, is even just going to make you more agitated. Did that happen?
Not for
When
him.
stress came?
No.
The frequency didn't change.
No.
No.
What about for you?
It increased, yeah, mine.
Your mind is somewhere else, right? Like,
Mine did change, because I was in more discomfort. I had pain, but he understood.
But I never
Pushed.
pushed, ever. I never pushed.
And he would tell me,
She
when
had to
you're
be,
ready, you come to me.
she had to be comfortable.
And that's what I did. I would go to him, and he understood. And so there was more hugs and holding hands and cuddling than.
what about the conversations with your doctor? Did you ever have to bring this up in a conversation with a doctor or another healthcare provider?
I don't think so. I don't remember.
We never did because we're so
No.
open.
Yeah, I don't think there was any questions or anything with doctors or professionals, or, I don't remember.
No,
Do
there
you?
wasn't.
No.
There wasn't any discussion. We didn't
No.
need to.
I know, I don't think so. I don't think there's an issue.
Would you have been comfortable? It doesn't seem like an
Yes.
easy conversation to have, yes?
Yes.
I think so.
Yes.
Yep.
You have to be open.
You have
Like,
to.
there's nothing wrong with talking about it,
Yeah.
about sex or about intimacy, however you want to
Sometimes
refer to it.
Sometimes if you communicate, it's like someone steps off your chest. You need to get it out. It's important to get it off your chest.
Do you think that this is a conversation that has had enough? I mean, you guys were lucky to have each other, but is this conversation happening out? I know a lot about things that happen to people when they have cancer. I know very little about what happens in this aspect.
I think I could see some couples maybe splitting up because of cancer. It can be tough, but you have to talk, you have to have the patience, you have to,
It's like a marriage, you have to put an effort in. You really do.
it's work.
Yeah.
It doesn't come easy. Marriage doesn't come easy.
And then,
Neither does the sex and intimacy either. It's work as well.
all right. Well, thank you very much for joining us tonight. We do have another guest that I want to bring into the discussion, like I mentioned. So, Sue, thank you for being with us tonight, and maybe we'll invite Ann Katz in to join the discussion now. So, everybody, I want to introduce you to Ann Katz, and we'll scoot over a little bit there. Getting comfortable, getting close, getting intimate here in the Cancer Center. I want to introduce everybody to Ann Katz. She's an author, and like I said, she's at Windsor Regional Hospital this week to speak with our healthcare professionals about having this conversation and how to approach it. So thank you for being here with us tonight. And I'll just get you to introduce yourself as well.
Sure. So I'm Dr. Ann Katz. I'm a nurse and a certified sexuality counselor. I'm from Cancer Care Manitoba in Winnipeg, and I was delighted to be invited to do a workshop tomorrow morning for the oncology care team, talking about getting them to start the conversation about cancer and sexuality.
Why is that such a hard conversation to have?
I think talking about sexuality remains somewhat of a taboo. I think in part it's because we live in a society that is perhaps more socially conservative than it certainly used to be perhaps in the late 60s and 70s. There's also a decided lack of education about this in undergraduate programs in medical school, nursing school. So, there's been this explosion of knowledge and content that people need to know about. So some stuff gets pushed to the outside, and this, I think, sometimes is a topic that makes people uncomfortable. We certainly didn't see that with John and Sue.
No, not at all.
They talk about everything, and they've been very generous in sharing with us this evening. As human beings, we have this unique ability to communicate, to talk in words, but sometimes oncology care providers don't use their words, and certainly couples often don't talk about this.
And I'm thinking about, you go to school to save lives. Is this something that's discussed in medical schools?
Very little. We're trying to change that, and I think we're certainly making some inroads. I think, and the research bears that out, that healthcare providers don't want to seem weird or intrusive in asking about things that are very private and very sensitive. But we also know that our patients want to talk about this. When healthcare providers don't open the door to the conversation, it says to the patient, this is taboo, the healthcare provider doesn't want to talk about it, and you land up with this deafening silence. So my mission over the last 10 years, certainly, and I've traveled all over the world talking about this, is to give healthcare providers, oncology care providers in particular, the tools to start the conversation. And when you open the door, patients will either step through that door and ask their questions, and it's a great relief for them. But sometimes they don't at the time. I think, frankly, because they're so shocked that somebody asked. But they will come back the next time and say, remember that conversation you had? Or remember that question you asked me? Well, and then they ask the question.
And what you're saying, I think, is both people have a responsibility here. The healthcare professional has a responsibility to open up that conversation, but also the patient needs to...
Well, I think the onus is on the healthcare provider, frankly. We ask about other side effects. We educate about other side effects, about nausea, about fatigue, about, scars, all of that kind of stuff. And yet this is a vitally important part of quality of life. And we don't talk about it.
So if you're just joining us, I want to introduce you again to our guest. We've got Ann Katz here. She's an expert on intimacy, sexuality, and cancer, and we're very fortunate to have her here tonight. So if you have any questions about this topic, maybe that you haven't had a chance or haven't felt comfortable asking your physician, please post them here. And we also have John and his wife, Sue, who have very generously agreed to come and share their experiences in the hope that it might help other people. And Anne, we've been talking about a lot of the emotional approach to this, but what about the physical limitations? Are there, what are some of the questions that you get asked about that?
Yeah, so the treatments that we use for cancer, predominantly surgery, radiation, chemotherapy, and now increasingly immune therapies, all potentially impact on sexual functioning. So, certainly for somebody like Sue who's had a mastectomy, with or without reconstruction, there are not infrequently significant body image issues. Think for a moment about a woman who is not partnered, or a young person who is just starting out on establishing relationships. Talking about a cancer history and perhaps a missing breast or some other body part is a huge challenge. And often people are reluctant to get into relationships because they don't know how to disclose, or they've had a bad experience disclosing. Not all couples talk as easily as John and Sue do, and they really do have to be commended. And their love for each other, I think, is really palpable. And thank you for sharing that with us. But some people find it really difficult to talk about, even to their partner that they are sexual with. We're human beings and we have the gift of words, but sometimes we communicate about things like that in grunts and squeaks. And over time, you learn what those grunts and squeaks mean, and you respond in a certain way. But when there have been changes, so for example, when a man is having erectile difficulties because he's had a radical prostatectomy or he's had surgery for colorectal cancer, if you're not used to saying the words, it's really, really difficult. And sometimes, we see couples really kind of drift apart and they land up living like roommates. And, being partnered is challenging. And when you're not
at the
sharing,
best of times.
Well, exactly. It is, as you said, it's work, right? It's effort, right? And it's not 50% effort. Both people have to put in 100% effort. So people, not infrequently land up sleeping in separate bedrooms, and that intimacy, that connectedness, and that really is the meaning of intimacy. It's not sex, that's a euphemism, right? That connectedness is lost, and you get two very lonely people.
And you started the conversation with talking about, what about the woman who doesn't have a partner, and how do you approach that with somebody? How do you approach that with someone?
Everybody has a different answer, and there is no correct answer. So some women just, let's just say they've gone on Match.com or one of those kinds of things, and they meet somebody for coffee at a coffee shop. There are some people, both men and women, who just immediately put it on the table, and then watch very carefully for what the response is. That's actually a little bit unfair, because I think when you go and meet somebody for coffee, you don't exactly necessarily expect that. So, sometimes the person might interpret the other person being completely at a loss for words as a negative. It might just be shock.
And you might be prepared for, I have kids, or, I'm divorced, but I've had cancer is probably one that hasn't crossed people's minds.
So some patients have said to me that the second date is actually the time to tell. Because it's not the first date where there might just not be any chemistry, so you don't ever see the person again. And do you really want to, put everything out on the table over coffee? The third date for some people feels a little bit too late, so they've said the second date works. Everybody has to do what they're comfortable with, but at some point, it's important, obviously, to talk about it.
So what if you have a partner who's very comfortable talking about it and one who's not? What can that partner do to kind of bridge that gap?
Well, they need to come and see somebody like me because, that's part of what I do. And we know this from work in psychology and social work, etc., that when you have an objective third person in the room, it really helps the couple to talk to each other. And not infrequently, I'll have a couple in my office and I ask a couple of questions and they actually move their chairs so that they're facing each other like this. And frankly, I could go to Tim Hortons and get a cup of tea. And I don't, I have to be there. I sometimes think, could I be answering my email? No, that would be rude. But they really do start talking because there's this implication that if things get heated, I'm going to step in. If the conversation stops, I'm going to step in and ask a probing question. So, getting help for this is really important. And it's not necessarily about, the nitty-gritty of what goes where and, where do arms and legs go. It's really very often about communication. And we make assumptions very often about what our partner is thinking or feeling. And I think we get it wrong about 80% of the time.
It's interesting. And so John and Sue, you seem to have a great way of communicating with each other, but was there ever anything that you felt wasn't being communicated properly, or you had a difficult time? What was the toughest thing that came up to talk about?
I don't think there was anything tough. I
It makes
think
it look easy.
well,
Yeah. You chose the wrong couple.
No, I don't think so.
I don't think it's. I think it's difficult, but some things are difficult. I don't think I really had a hard time discussing anything with Sue. I was open with her, and she was open with me. And like I said earlier, it gets you through it if you communicate. You have to talk to your partner. You just have to. It's very important.
Maybe just your emotions.
Emotionally, I was, the chemo, I think, went to my head a little bit and messed me up a little bit. Emotionally, I was very agitated. Not towards Sue or my daughters. I was just an agitated guy for a little while. But I got over it.
So what can sometimes happen there, if there isn't that communication, is often the partner internalizes whatever the issue is and starts to blame themselves. So, you obviously worked through this and talked about it, but sometimes when you do have someone who's perhaps got a really short fuse, the partner starts to think, what did I do wrong? What am I not doing right? How am I not supporting him or her? And it's not that at all, right?
It's not. And
So
we talked about that as well.
Yeah.
And we I said, it's not you, it's just me. I'm just dealing with this, and it's doing something different to me. And that I'm going to be fine. Everything's going to be cool.
And I think that one of the important things to note from that, though, is that that's normal. Because
Absolutely.
there's maybe people out there feeling that way right now, and thinking, why is my husband acting like that? Why is my wife acting like that? Why am I acting like
And
that?
that will be the prime reason why that's happening. The treatment will do that.
Yep.
Now, I'm not saying it's going to do it to everybody, but it did it to me.
We have a question here from Barb Lather. Barb, thanks for joining the conversation tonight. And I think this one's for Anne. She says, are there tools to help your partner understand that you're nervous about having intercourse, and will it hurt?
Once again, it's communication. So, when pain is protective, right? So, one of the problems is if you have tried to have sex and it hurt, every muscle in your body tenses up, and then it hurts. I'm talking from a woman's perspective, right? Barb's a woman. And then it, I'll get to that.
Sue's giving advice from the other side of the camera.
So fear causes all the muscles in your body to tense up, including the muscles of the pelvic floor. So often intercourse becomes absolutely impossible. But it's important to talk about it and say, I'm nervous. There are certainly things that you can use. Lubricants can be very, very helpful. I'm actually not a huge
Pass
fan
me your
of...
advice.
Yeah, so Sue suggested KY. I'm actually not a huge fan of
Here's
KY.
the advice from Sue.
So KY itself is not a particularly good lubricant. There are many, many others that are much, much better.
You have to go back to Shoppers.
And it really, speaking of going to the drugstore, it's absolutely overwhelming. I think 20 or 25 years ago, that's all there was. Or people are stealing it out of the examination room. I'm not sure which it is. But, today there are probably, at every drugstore, there are probably about 60 different kinds of lubricants, and you've got to be really careful because many of them contain glycerin, which can impact on the natural pH. They contain propylene glycol. You know what propylene glycol is?
And what-
This is Jeopardy.
Antifreeze.
Really? Mm-hmm. Well, she would be cold.
It's used as a preservative. They contain parabens, perfumes, flavors, all kinds of things. So you've got to be really careful and read labels. Simpler is better. I have a handout that I give to my patients that gives them some guidance because it really is overwhelming when you go to the drugstore. Anything that's got a big X on the box, do not use. Anything that's warming, cooling, exploding, or intensifying should not be used because they all contain irritants. And for women who've had chemotherapy or women who are really going through menopause as a result of the treatment, things down there are very, very sensitive. So you don't want to be using anything that's going to irritate things.
Do you have one of those handouts handy?
I don't, but I can certainly send it to you.
Thank you.
Or online, we can post it underneath here. Is there a certain brand that you recommend?
I happen to like a brand called Astroglide Naturals. It's relatively cheap. You can get it at most drugstores. It comes in a green box or in a green bottle. They keep changing the packaging on me, which is very irritating. But it's the green one. It's not the purple one. It's not the purple and red one. And it basically contains aloe vera and vitamin E. So it's non-irritating. There's some others that also are okay. I think ask your healthcare providers. Nurses are often very, very helpful in this regard, and I will certainly share the resources that I have with the folks here, and they can be free to hand those out.
Yeah, anything that we have, we'll post them and make sure that everyone who's been part of this discussion can see them there. A question from the audience: does chemo affect sexual performance?
That depends. So,
Sue's saying no, not for her, not for.
Yeah. So chemotherapy, particularly for women, can put them into what's called chemical menopause. So it's not the normal sort of over 10 or 15 years gradual decline in estrogen, which then leads to menopause. It's the immediate cessation and immediate decrease in circulating estrogen, which causes not only vaginal dryness but vulval dryness as well. So any kind of sexual touch can be very, very painful. So that will impact on sexual performance. For men, there are certain kinds of chemotherapy that are really toxic to nerves. So, and not selectively to nerves, it's to nerves in general. So we sometimes will see men experiencing erectile problems as a result of being on chemotherapy because of that neurotoxicity.
And does that affect other parts of your body too, like the sensitivity to
Absolutely.
touch? Is that something that you noticed?
I have neuropathy in my
Yep.
hands and feet.
Yeah, so it's not selective just to hands and feet. So I've actually seen more women than men, but women who actually have genital manifestations of that, and it's very, very painful.
Wow.
And are there ways to work through that?
Well, certainly medication. I think that other things really don't help. You need to get to the root of the problem. So there are some medications that can help with peripheral neuropathy, including genital peripheral neuropathy.
So if you're just joining us, we've got Dr. Ann Katz and John in the Cancer Center studio this evening. Please post your questions if you have them. You can even post for a friend if you want. But
Hypothetical.
post for your friend or really post for your friend. But lots of questions I know that are out there. When I've been telling people that we were going to do this, lots of great discussions come up because everybody says it's a conversation that doesn't happen very often. So please take this opportunity. We've got some great resources here. And I do have another question from Facebook. It says, is Viagra compatible with chemo? Is that something that you know?
Absolutely. So Viagra is just one of a class of drugs. What's important for people to know is that these drugs, they're called PD5 inhibitors, that's the class of drugs, they do not cause an erection, they only help to maintain an erection. So you actually have to physically get blood down there. They don't help for everybody, but certainly they can be helpful for men who have some performance anxiety. So if a man has had a failure to achieve an erection once, twice, 5 times, very often he has a little voice in his head, right, that the next time he tries it says, is it going to work? Remember last time?
She's not looking at you.
Yeah,
Never.
I'm not. And it's generally the voice of his mother. Sorry, I had to stick
You
that
just
in.
ruined it for everybody.
And
That's a turtle.
oh, you know that too. Good for you. So those drugs can actually be quite helpful because they act as almost a little safety net. But they are often not that effective, and we know that many men actually never refill their prescription. So that's saying something. They're also very, very expensive, which is a huge problem.
Okay. Is the experience different for men and women? I assume, listening to Sue's story and listening to John's story, what is happening to your body is 2 complete different things, and the way that you approach sex to begin with differently. So what is the impact?
I think men and women are different. Individuals are different.
You have your 2 books here, Sex.
Yeah, man cancer sex and woman cancer sex. One of the, I think, really the sentinel differences is that men tend to have a much more robust body image than women. And I think this is, influenced by society, right? Many of us have been told you're not thin enough, you're not curvy enough, you're not pretty enough. So we tend to, I think, sometimes really take physical changes very, very seriously, and also almost sort of take those into who we are and judge ourselves incredibly harshly. Whereas with men, as men get older, their bodies change, right? They get a bit of a tummy, and their butt completely disappears, and they're quite happy.
And they love it.
And they love it, Don't see any difference. And, you ask most women whether they've had cancer or not, like, how often do you look at yourself naked in the mirror? They'll say, never. Whereas men, different story.
And Sue's experience with losing a breast, and she said, I still feel like a woman, and that has a lot to do with John. What if you don't have a John?
That's, I think this is a key element to successful survivorship and really sort of physical and emotional integrity or comfort. Many women really, really suffer after breast cancer with body image issues. Women who've had reconstruction and perhaps had some unrealistic expectations of what the reconstruction is going to be like. There's still a lot of scarring. If you've had bilateral reconstruction, both your breasts are going to look different, feel different, react differently. And I think in the trauma of diagnosis and making a treatment decision, women often don't think of that because they just can't, right? They're thinking, am I going to live or am I going to die? So I see a lot of women in my practice with body image issues.
Mm-hmm. A comment from Steve Marks. Steve, thanks for joining us tonight. He says, enjoying the frank discussion, and indeed, we're open for questions. Please ask anything that you want. We're not seeing as many questions as we normally do, and I'm not surprised. This is a difficult platform to put yourself out there and ask the questions. But Anne, behind closed doors, when you've got the individual or the couple, what questions do you get asked the most?
Will it be like it was before?
And
that's probably, and it's going to be different. But it's different as we age. It's different at different stages in our lives. But, people want life to be as it was before the cancer. And I think that, it stands to reason that they want how they see themselves as sexual beings to be the same and how they respond sexually as well.
it's not. It could be better.
Absolutely, it could be better. And I think, certainly John and Sue are an example of a couple who have really come through the fire of cancer and its treatment and are closer together. And we see that a lot. I certainly have seen some couples that have split up. Was it because of the cancer? Maybe the cancer was just, the event that showed them that things are not great. But most couples really do get closer because of what they've been through.
It was different at the beginning, though.
Sue says it was different at the beginning. How does it?
Because of his neuropathy, he had to learn to touch and feel those
I
special
couldn't pick up a
areas.
quarter off the floor because I couldn't feel it from the neuropathy. Like, so my senses in my
Yep.
hands, as well as
He
my
had to
feet.
relearn.
I had to re-educate myself.
I hope you practiced a
Oh,
lot.
absolutely.
Oh, okay, good.
I didn't have any doubt. Did you have any doubt? I think we've kind of covered this, but I don't think we can say enough the right way to bring up the conversation with your spouse.
Yeah, I think that's a difficult one. As human beings, we're gifted with speech, but, we still struggle with this. It's important to talk in I statements, I feel this way, instead of saying, you make me feel, because that's accusatory, and then the other person gets defensive. Not to talk in the bedroom. That's also important, right?
Or at the local pub, probably either.
Yeah, it depends on how much noise there is, but don't talk about it where you have sex, because that becomes very, very emotionally laden. Take turns speaking. Don't interrupt. The normal things about good communication between couples, and people often, I find couples often are really afraid to hurt the other person's feelings. So they don't often fully disclose how they're feeling. And so that's once again why you need an objective outsider to really help that conversation along.
It's an interesting conversation. I'm wondering, what was your career path that led you here? I'm going to talk about something that nobody else is talking about.
Yeah, I've had a very interesting career. I'm a nurse. I now have a doctoral degree, and I've always sort of worked on the edges of I've never worked in traditional nursing positions. So I worked in HIV/AIDS at a time where, let's just say I wasn't popular with my children's mommies because I was working in HIV and AIDS, and I think they thought I would bring cooties. Yeah, that wasn't so good. So after I finished my PhD, I actually went to the University of Guelph to do an intensive sex therapy program. It's something I've always been interested in, and we've got a University of Guelph alum or faculty person here, so yeah, great institution, and it was a fabulous course. And I then actually had a private practice for a couple of years, but I just felt that as a nurse I could bring a unique skill set to this because
Certainly.
I understood the anatomy, the physiology, the treatment effects, etc. And I wrote a proposal and took it to Cancer Care Manitoba and said, I was actually teaching at the university at the time, I was full-time faculty, and I had the opportunity to practice one day a week in the clinical area. Cancer Care didn't have to pay for me. It was my faculty practice, and honestly, it was the best day of my week. And I did that for 2 years, and then came on board as I'm in a clinical nurse specialist position, but I do the sexuality counseling, and it's really increasingly a bigger and bigger part of my practice.
It must be really rewarding.
Hugely rewarding. And often people, when they find out what I do, besides asking me sort of really personal questions, they often say to me, "Oh, you work in cancer. That's got to be so sad." And it really, really isn't, because when a couple come through my door and say, we're having sexual problems, that for me means that they really are through the trauma and the chaos of treatment, and they want life to be normal.
And we have a question here from Peter through email, and I think that this transitions into something that I wanted to say. I want to recognize that we also have one of our social workers in the Cancer Center tonight, Joyce McManus, and she is very, very passionate about this as well. So we do have people within the Cancer Center, Joyce and other members of her team, who can answer these questions when they come up. You might want to ask, but we do have people here. And another question, are there any local support groups? Where else can a patient get help with this issue? So again, we do have members of the team here. And also, I was doing some research about this, and the Canadian Cancer Society does have some great tools on its website. So I'll post that underneath this post this evening, and anything else that Anne wants to share with me. Also, if you want to hurry up and ask your questions, anybody who posts will be entered into a draw tonight for a chance to win one of Anne's books, or you can go online maybe and buy one of these books. Go.
Absolutely.
They seem like they would be very good resources for people who have questions. And how long have you been doing this for?
17 years.
Okay, so has that discussion changed over time? You mentioned back in the 60s everyone was more comfortable talking about it, so where are we at now on that spectrum?
You know, from my perspective, certainly every time I see a patient and I see couples together, because this is not something that you can fix by yourself. If you're part of a couple, you need to, you know, come for counseling as a couple. And this is not lie on my couch and tell me about your toilet training when you were two kind of counseling. It's very much resolution focused, and I tend not to see, you know, patients for 6, 7, 8, 9, 10 years. Generally within 6 months we can get most things sorted out. I certainly have learned a lot from all my patients. So, you know, besides having written the textbook and then another bunch of books basically for survivors and their partner, I've learned a lot. So I think over time, really, I've become much more comfortable as well. You know, honestly, there have been times where people have told me stuff that inside I'm going, but they would never know from my face. I put on my nurse face.
Can you share any of those moments, or?
Oh, well, you know, I have a sort of, I've actually written about this. I had this patient who I had met him and his wife sort of earlier on in his treatment decision-making process, and they were an older couple, and they said, you know, he was going to have a radical prostatectomy for prostate cancer, and he said, you know, they both said sex doesn't matter, we haven't been sexually active for many, many years. He went ahead and had the surgery, and about 6 months later he showed up because now he wanted help with erections. And I remembered the conversation I had with him and his wife, and I think I lost my filters for a second, and I said to him, but I thought sex didn't matter. And he sort of looked at me, and I could see he was really embarrassed. And then I said, once again, I didn't find my filters, I said, are you seeing someone outside of your marriage?
Oh.
And he was. And that for me actually caused some really moral distress for me, because I hold my marriage as something that is, you know, very, very important, and that for me there's a certain sanctity in marriage. And, you know, here was this guy who had a different set of values, and that really challenged me as to, you know, what I was going to do. And I certainly thought about it a lot, and I landed up actually publishing this case in the Journal of Clinical Oncology, and ultimately it was my duty to help him. I had to put my own moral issues aside, and it was not that easy. You know?
But he was happier for it,
He was happier for it, and, you know, and I didn't pry into what else was going on in the marriage. She didn't obviously, his wife didn't come back, but I saw him a number of times, and, you know, he's a nice guy, and this was their marriage.
So the moral of that story is you can ask her anything.
You can pretty much ask me anything.
Do you get many young adults coming through looking for advice? And if you do, are the topics that they want to talk about different?
I get lots of young adults. I also do the fertility preservation counseling at Cancer Care Manitoba, so I'm deeply honored to do that as well. You know, young adults are in a unique situation. So young adulthood is by definition, is 19 to 35. It's a very broad age range, because a 19 and 20-year-old is going to have very different issues to a 34-year-old who may be in a long-term relationship. But often, you know, it's about those developmental milestones that you have to go through in order to become adults. So who do you want to be? Who do you want to be with? You know, who do you want to be sexual with? Do you want to settle down with one person? And your sexual identity is really not yet established, particularly in the younger age range. So these young people are often really, really challenged because of the changes that they have gone through.
Yeah, cancer can really throw something at that, right?
Yeah,
when you're trying to figure out who you are, and then...
Correct. So, you know, think about a 24-year-old woman who's lost a breast. And some of the challenges that she'll go through. Think about a young man who's perhaps lost a testicle to testicular cancer. We're seeing an increase in the number of young adults with colorectal cancer. So you've got,
Colostomy bags.
so you're thinking of ostomy bags, you're thinking of a whole host of other things as well. And so yes, I do. And they often are very, very challenging because they really are going through all these changes.
Do I hear more questions coming our way? So I think we have another question from the audience. Do you have any questions for Anne?
No, she's very explanatory. She's
Right
she's
to
right
it.
to the point. That's
Yeah,
awesome.
my middle name is Frank.
God love you. Let's be frank.
Is there anything that we've missed in the discussion that you think is important for people who are joining us tonight to take away?
I think that whereas I certainly said at the beginning that I believe that the responsibility is that of the oncology care provider to talk about, if the oncology care provider is not asking the question, and I think that we really have come a long way, and nurses are a great resource because really nurses are at the interface and seeing the patient, often every day through chemotherapy or every day through radiation therapy. So they're often good people to ask. And, they're people that you can be referred to here in Windsor, so that's important as well. So if your oncology care provider doesn't talk about it, I have the saying, put on your big old panties, or I guess your big boy gitch, and just ask. Say, that might be a Manitoba thing,
Yeah.
underwear. I think it might be a Manitoba thing. I thought it was Canadian. There you go. You see, you learn something new every day. So just, you don't even have to say penis. You can say, you know what, we're struggling a little bit in our relationship, and that opens the door.
We've made it, a half hour, and we never used the word penis.
There you go.
We did just once.
A question from Barb. She says, I know many cancer patients where their partner may be in denial and not want to talk and won't seek counseling. How do you address this?
I then will see the individual with cancer, and I will have a very frank discussion with them about how they are not going to fix this by themselves. And very often, I think the individual, the survivor, going back and saying, you know what, it wasn't that bad. She's like, only a little bit scary. Sometimes that helps. There's a lot of misunderstanding about this. I don't want people getting naked in my office. I don't get naked in my office.
That's good to know.
Yeah, so there's no physical examination. I don't want to see people's bits and bobs. This is about talking, and I don't have truth serum, so I deal with what people tell me or give me. So, I'm at that interface, and I will try my best, as will, social workers here, to help people. But we can only deal with what we deal with. But I think generally we're sensitive, we're respectful, and we want to help.
So I think that that's a good place to close tonight's show. There is help. There are places to have these discussions, even though it's not a discussion that maybe takes place as often as it should. If you want to talk about it, there are ways to bring that into the discussion, right?
Absolutely.
Mm-hmm.
Thank you so much for being here, John and Sue, for sharing your experience.
You're welcome.
And Anne, looking
Very
forward
welcome.
to the discussion tomorrow also with our healthcare workers on site here at Windsor Regional Hospital. And thank you to all of you who took part in tonight's discussion. I hope that you found some value in it. I want to mention we've got another episode of Cancer Center Live scheduled for this month. Some of you may know Michelle Prince. She's been on a cancer journey for a while now, chiropractor in the city and wife of the former mayor, Eddie Francis. She wants to share her experience in the chemo suite and really pull back the curtain and show people what it's like in there. Give some tips for, if you've never been and you have to go, what should you expect? What can you expect? Or if you're already going, how can you maybe make that trip easier? So another really brave individual willing to share her story, and we're really looking forward to that. So watch our page here for more details on that coming in the next couple of weeks. Again, thank you guys both very much.
You're welcome.
Thank you, Sue, and thanks to all of you. And I hope everyone has a good night. Bye-bye.